Julia Neighbors. I am the director of Prevent Child Abuse Georgia. And I, along with our team, want to thank you for joining us today to talk about your role as a mandated reporter, especially during this time of physical distancing, or as we call it, as opposed to social distancing and sheltering in place. So now more than ever before, we all need to be vigilant for instances of abuse and neglect and to ensure our children's well-being. This webinar is being brought to you by Prevent Child Abuse Georgia in collaboration with our partners at the Georgia Division of Family and Children's Services, the Department of Education, and the Georgia Center for Child Advocacy. We also thank our partners at the Stephanie Blank Center for Safe and Healthy Children at Children's Healthcare of Atlanta, that's a mouthful, and Pro for their support. So as you know, mandated reporters are interacting with children and youth in new and unfamiliar ways, such as virtual classrooms, phone calls, food drop-offs, to name a few. And mandated reporters need tips and best practices on how to make a report during this time, and really just to how to navigate our role during this time. And so here we're planning to share resources with you all, and so that you can support the families that you work with. And so we hope that this will provide you with some additional resources as you move forward in your role. And I also want to have you keep in mind something that was shared with me, and I think it's always important for us to think that we are not merely just working from home or remote distance learning from home. We're actually living through a worldwide crisis, trying to figure out how we do our work and how children learn at home while we're doing it. And so we need to keep that in mind, that this is not what most of us envision when we talk about remote working and remote learning. So I want to thank you for being here, and I'm going to turn it over to Naisha, who's going to get us started.
Awesome. Thank you so much for that, Julia. All right, so my name is Naisha McDowell. I'm the Training and Helpline Coordinator for Prevent Child Abuse Georgia, and I just want to say thank you all so much for attending. So what we want to do now is just go through some quick housekeeping items. This webinar will last approximately 1 hour and 15 minutes. We want to make sure we get you all in and out. And we also ask, what we did was we went ahead and muted you all, and we're doing this because we had 1,204 people register for this webinar. Currently, we have about 800 people on. So that's a lot of folks that we have to try and manage. So we can't all have our sound on right now. So we do have you muted for the time being, and we'll likely take questions in the chat box. Additionally, just please make sure that your sound is on. I know for the folks who can hear me right now, you know that, but we just wanted to keep this slide up for a moment so that people would know to use the audio function at the bottom of their screen to join via computer or via phone. So we just wanted to make sure that everyone understood that. If you can still hear me, just put another yes. I wish there was a thumbs up option. That would be a lot easier. All right, so just to go through a few objectives for this webinar, the ultimate goal of today's webinar is to discuss how your programs, organizations, communities, and you as an individual can protect children. So even in the midst of COVID-19, we still need to maintain our role as mandated reporters. So this webinar will discuss some of the pertinent definitions and reporting methods, provide an update on the decrease in child abuse and neglect reports and DFCS response, and provide mandated reporters with some useful tools and resources to address reporting concerns. So this is just a quick agenda for our people who like to make sure that we're staying with the agenda. So we're going to do a quick mandated reporting overview, and this overview will basically help us understand, make sure we're all on the same page. And what I will say, everyone, the New York Times did release an article saying that there are basically Zoom hackers out there. Not sure why they have so much time on their hands, but if you see some alarming things go on the screen or some drawings, that is not us at PCA Georgia or any of our partners. That is a Zoom hacker. So we're going to try to push through this as best we can, okay? So after we go through our brief mandated reporting overview, we're also going to hear from the Division of Family and Children's Services, Mrs. Jacqueline Clyde. She's the lead field program specialist for the CPS Intake Communications Center. So she'll provide some updates and a response. We'll also hear from the Department of Education and their updates and response from Mrs. Cheryl Galloway Benefield, and she's the program manager for Safe and Supportive Schools. And then we'll discuss some great mandated reporting resources and prevention related resources. So we have Mrs. Tiffany Sawyer. She's the Director of Prevention Services with the Georgia Center for Child Advocacy, and she'll discuss those items. And then lastly, we'll follow up with how to make a report and then some Q&A. So I just want to reiterate for a moment that this is not a formal mandated reporter training. There are actually some online free resources and in-person free resources for that. This is only a webinar to provide some updates in the midst of this pandemic. So if you would like a formal training, we'll talk about how you can access that. All right, so COVID-19. In times of crisis and economic instability, the risk of abuse and neglect increases, and we know this from past worldwide events. The COVID-19 pandemic has triggered substantial stress and uncertainty for families across the country and really across the globe. Routines have been interrupted due to businesses, schools, and daycares closing, and many families are spending long periods of time in close quarters. For some, this can be stressful when coupled with work demands, bills, and other stressors. Additionally, unemployment has skyrocketed over the last couple of weeks. Over 6.6 million people filed for unemployment as of April 2nd. And lastly, children are isolated from places where adults often look out for their safety and well-being. And this includes schools, childcare facilities, places of worship, and other public areas. Many mandated reporters, such as yourselves, are not able to have that face-to-face contact that you're accustomed to and the ability to recognize a child who may be experiencing maltreatment. So it's really important for us to understand our role now more than ever. So before we dive deeper into our conversation, it wouldn't be right if we did not cover some prevention language. So before we dive a little bit deeper, we want to stress the importance of prevention and preventing child abuse and neglect before it occurs. So prevention efforts save lives and billions of dollars that would otherwise be spent in our healthcare systems or even within our criminal justice system. So we now have an understanding of the science, and we have the science to support what we already knew. And that's the fact that child abuse and neglect and any type of adverse childhood experience is harmful to a child's overall well-being and health, even during the long term. So how many of you have heard of the Adverse Childhood Experiences Study? And if you have, just put a Y in the comment section. A lot of people are saying yes, that's great. So the Adverse Childhood Experiences Study, for those of you who are not as familiar, it was a study conducted by the CDC and Kaiser Permanente in the late 90s, and it has shown a clear link between early traumatic experiences, including child maltreatment and poor health outcomes in adulthood. So basically, children exposed to more adverse childhood experiences, such as abuse and neglect, for instance, or mental health, or any type of maybe domestic violence, those children may be at higher risk of chronic disease or mental health challenges as adults. So while ACEs can have lifelong consequences, there is hope through protective factors such as resilience. And resilience is basically the ability to return to being healthy and hopeful after something bad has occurred. Research reveals that parents, teachers, communities that provide safe environments for their children and teach them how to be resilient can help reduce the effects of ACEs. So we wanted to make sure that you were aware of just how important prevention is in this greater conversation that we're having. So we talked a little bit about the importance of prevention, and we will ultimately go over some great resources related to prevention. But first, we're going to cover mandated reporting. So this is basically just a list covering who is mandated to report in the state of Georgia. So most of the individuals on this list either come into direct contact or indirect contact with children, and that's either professionally or through volunteering. And in the past couple of years, we want to mention that volunteers have been added to this list. So we want you to understand that even within your organizations that use volunteer support, please make sure that your volunteers are included in mandated reporting policies as well. So if you're reporting your suspicion of child maltreatment, it is assumed that you are doing so in good faith. And these are just some reminders for our mandated reporters. So you will not be liable if the report ends up being unsubstantiated or basically unconfirmed. So additionally, it is not your role to investigate or collect proof. So no reports will be based on suspicion, so most reports are definitely going to be based on suspicions or good faith. The law stands by you in that. So it is DFAC's job to ensure the safety of children and to do the investigative work. So please simply familiarize yourself with your organization's reporting policy. And for instance, if you have a designated mandated reporter or a central mandated reporter, make sure that you're making reports to that person, and then that person is passing all the reports on to DFACs. However, if your policy requires you to make a report by yourself and then maybe update your supervisor after you've done so, please follow that policy as well. Just to mention, mandated reporters are allowed to report anonymously and maintain some confidentiality regarding their identity. Additionally, they can limit their liability by following some easy and clear procedures. For instance, if a person is a mandated reporter, as we stated earlier, they can report to their designated reporter. And as long as that person moves forward with that report, they have fulfilled their legal obligation. And we want to stress that if you are a designated reporter within your organization, you are required to submit that report onto DFACs, whether or not you agree with it. So if that person comes to you and they make that report and they want to move forward, then you have to be sure to do that on behalf of that person. And it's just a good rule of thumb for anyone who has to report to a designated mandated reporter. Never be afraid to follow up with that person to make sure that they actually made the report to DFACs. All right, so I'm just gonna check and make sure. So as far as the survey information, we will send that all out to you, and this is being recorded, so you can go back and watch it or send it to someone else. Really quickly, what's reportable to DFAC? So there's an entire online training about this information, so we will not go in depth, but we did want to reiterate what's reportable. So those things include physical abuse, neglect, sexual abuse. So in the state of Georgia, that also includes the commercial sexual exploitation of children, or it's commonly referred to as child sex trafficking. So if you do suspect that a child is being trafficked, you can report that to DFACs. Of course, if the child is in immediate danger, call 911. Additionally, you can report emotional or psychological abuse and child endangerment. And the things that fall under child endangerment include prenatal abuse, commission of a crime in the presence of a child, driving under the influence with the child in the vehicle, and intimate partner violence in the presence of a child. This is just a quick chart, which is showing us the indicators of abuse. Again, there is training on this information, but we just wanted you to be aware of maybe some indicators that you may see in virtual interactions with youth, or it may be even some in-person interactions if you do any additional work outside of the home or you're having interactions with youth still. So as far as physical abuse goes, you may see some of the behavioral indicators before you see physical indicators in the times that we're living in right now. So having those virtual interactions. So maybe the child is frightened of parents. There could be some self-destructive behaviors that you're observing. You may observe some physical indicators as well, such as a bruised eye, or maybe some welts or burns on the child, or maybe a new fracture or dislocation. As far as sexual abuse, this really depends on your interaction with the child. We mostly see the behavioral indicators before we see the physical indicators, unless you're very close to the child or work in a healthcare profession. So with that, there could be some inappropriate language around sex, or it may be advanced sexual knowledge, withdrawal, or depression on behalf of the child. For emotional abuse, it may be some antisocial or destructive behaviors, speech or communication disorders, different things like that. And lastly, neglect. You may notice that the child may not be attending school as regularly or not completing assignments. We all understand that we have to give one another grace in the time of this pandemic, but maybe this child has not logged in weeks. There's been no communication with the parent or with their guardian. So there could be some concerns around whether or not the child is getting the proper education or their proper educational needs met. There could also be some issues with the caretaker at home, and the child may be exhibiting some challenges with that. All right, so I know we just sped through some of that update information, but we'll talk about how you can be trained. What we're going to do now is talk about some updates in response, and we'll have Ms. Jacqueline Clyde with DFACs discuss those updates in response. So if you all will just give me a quick moment to unmute her and make sure that she has the proper tools to talk to us. So Ms. Jacqueline, I'm going to unmute you. Give me 1 second. All right. Can you hear me, Miss Clyde?
Yes, I can.
Awesome. And feel free to share your video as well if you would like to, but otherwise we can hear you pretty well now.
Great. A couple of things that we've done as far as the agency is concerned is that the director, Tom Rollins, sent out an email to all the staff of DFACS on the 16th of March to let them know there would be some changes in the way we approached our work because of the pandemic. Now, well, I'll talk about some of the things first with the totals reports that's come in. From March 9th, 2019 to March 2020, on the video, on the slide, you'll see the changes across the spectrum of how we approach the work. March is normally our highest rated intake month for the year. And in 2019, we were at a normal rate of intakes that we were receiving from our mandated reporters along with our non-mandated reporters. This chart actually shows the actual intakes that we receive rather than the phone calls. Our phone calls are normally about 5,000 more phone calls than we have that actually end in reports. But these are actually the reports that we received and how we disposition the reports. With the initial safety assessments, we had about a little over 8,000 of those in March 2019. And I'm going to try and move over my screen because people's videos are covering that up. This year, after schools were closed, we actually went down drastically in our reporting of our intakes. The total intakes from 2019 to 2020, March, we screened out 36% of our reports, and then we did about 60% where we screened them in, 64% where we screened in, and actually assessed those reports. We had 4% special investigations, meaning that those children were either in foster care or something happened at the school or some other facility where that incident happened. That was about 4% of our reports. Next slide, please. March of this year in 2020, please go back one. Sorry. Oh, one more. Yeah. March 2020 of this year, when on the 18th, when the schools were closed, 28% of our reports actually came in from our mandated reporters. However, 72% of our reports that we received for the full month between March and the 1st and March the 17th, we received 72% of all the reports that came in for March. Only 28% of our reports came in after the kids went home. And that's almost half of the month that we actually went down. So half of our reports that we normally would get for the end of the month, we didn't receive at all on the children. And that's scary at this point. And I looked at the actual reports that we received last Friday for this month alone, and I think we still at 50% of our reports we have not received on our children. We normally get in the month of April. The next slide will show a drastic change. The next slide. And I did a comparison of the schools, how important the school reports are to us. In March, the 1st through the 17th, 2,500 and 2,520 reports came from our school. 2,941 reports came from other mandated reporters. That's just the first half of the month. But on the second half of the month, from the 18th to 31st, only 255 reports we received from our schools, while only 1,700 reports we received from our other mandated reporters. So our mandated reporters, I know they're not seeing the children either, but it shows how important the schools are to making reports on our children. And when school is out, or the children not attending schools, we're only getting like less than a third of our, or a fourth of our reports that we would normally get for those children. So that put a lot of more pressure on the rest of our mandated reporters, and we're hoping that the children are having other contact, not on a regular basis, but if you are a mandated reporter and you live in a neighborhood with children, if you go to the store and see children, if you walking down the street exercising, anything, if you have any contact with any children, please make those reports, because we now don't have the eyes for the schools on those children. Some of the updates that we received, and this is what I was talking about at the beginning of the conversation, is that on the 16th of March, Tom Rollins Director Tom Rollins sent out an email notification of changing our SOP on the way that we approach our work with CICC and the rest of our field. CICC added a question to our mandated reporters, and all of our reporters will be asking the question about if a family member or anyone in the household has been ill recently. That information is very important to our field staff who have to make contact with our families, so that they will know in advance of making contact with the family if the family has possibly been exposed to the coronavirus. When our staff make contact with our families, they are supposed to make sure that they call and get some additional information. They maybe end up having to call you back to get additional information because they're asking an additional question, whether the family or any family members have traveled outside of the country recently. And they may ask you some additional information in the way of the coronavirus symptoms or in something like that. They also have been granted access to, if there's no safety concerns for the field staff, they can see the family by Skype, FaceTime, or any other applications that they have on their phones, or any telephone calls. They may make contact with the family through those other avenues rather than making face-to-face contact. There are going to have to be some contact with the family if there are some safety concerns, and they will take extra precautions. They will include their supervisor and their county directors on any specifics they have in place to make sure that the field staff remain safe. They do have some limited safety equipment that they've issued to some of the field staff also, for them to make contact with the families. And they have those local protocols also in place. They do have to take precautionary steps before they make contact. No, we had someone was concerned about that. They do have to make those extra precautions. Some of the things that we are having, they are making extra contacts with the families because of the coronavirus by FaceTime and by Skype. And then that's really all the updates that we have as far as the coronavirus is concerned. But I just want to emphasize how important it is for mandated reporters, since the schools are out, how important it all is for all mandated reporters to make reports. Any suspicions of allegations of maltreatment, please make those reports.
Absolutely. Thank you so much, Ms. Clyde, for those updates and for that information. That was definitely helpful in just gaining a scope of what's happening right now during the COVID-19 pandemic. So thank you for that. All right. So next, we are going to have Ms. Cheryl Galloway Benefield present to us on updates and response from the Georgia Department of Education. So just give me one moment to unmute her. All right, Cheryl, are you able to hear us?
I am. Can you hear me?
Yes, ma'am, I can hear you. Awesome.
All right.
So I'm going to let you take it away.
Okay. Good afternoon, everyone. I am the program manager for Safe and Supportive Schools at Georgia Department of Education, and mandated reporting is one of the areas that falls under what we do. I wanted to start with talking a little bit about what's happened regarding school closure in the state and how the Department of Education has responded. This aligns, you'll see here, the school closure timeline pretty closely with when we saw the drop-off in reports and mandated reporting. On March 10th, Fulton County closed 2 of their schools, closed their system for a day, closed a couple of their schools for a couple of days. It was very much a trickle effect. Different districts who started seeing cases of COVID-19 were closing sporadically. The governor closed all schools on March 16th through the end of the month. The closure was extended on April 24th, and then on April 1st, school closure was extended for the remainder of the school year. So I think you can pretty easily see how that school closure impacted those reports. I'm sorry, next slide. There we go. So if you're looking for more information on what schools are doing, or just information about COVID-19 and the educational response in the state, we have a dedicated COVID-19 page. There's the hyperlink to it. And on that page, anytime there is an executive order from the governor, particularly related to education, we'll post it there. The site is updated regularly. When we get waivers in from the U.S. Department of Education, USDA regarding nutrition, things like that, all of those are posted on this site as well. You'll see trending K-12 topics and hotlines there. So if you're looking for information particular to what your student or your children may be experiencing, you can go here for information. Next slide. And here you'll see we have it kind of organized into some very easy to navigate tabs on that Georgia Insights page. You can look for information for families, educators, school districts. Everything is public, everything is there and available. There have been a lot of questions for the department around graduating seniors. What does it mean as far as graduation itself, the actual graduation from high school, receiving a diploma, as well as some of the events surrounding senior year. So a lot of information here, a lot of questions that you may have can be easily answered if you go to this page and just kind of look under the different headings and the different tabs. I want to draw specific attention to the bottom left. You'll see crisis contacts. And on that page, we've listed some very specific numbers. Next slide. Here you'll see the second one we have there is the 1855 Georgia Child. The child abuse number is there. GCAL is at the top. So we have crisis contacts here for people who may be in an emotional or mental health crisis. Of course, they can always reach out for help. We have the CARES Warm Line for substance abuse. Specifically, we have the child abuse hotline, but you'll see a lot of things there. This is not the entire list. I just grabbed a representative sample, what's there as you log on to the page, as you click on it. But we do have the domestic abuse hotline there, all of the crisis lines that we knew were accessible immediately, and we're adding to it as more are reported to us. So if you have any information to share, please do that, and we'll get other crisis lines added as they're vetted. Next slide. So when it comes to mandated reporting during a pandemic, what we have, of course, communicated to schools is that mandated reporting is still required. And what we're hearing back from schools, because we are in contact, we're talking with the people who are over school counseling, school nurses, social workers, and we're speaking directly with some of those school nurses and social workers and counselors, because these are typically the people who might have some of the responsibility for reporting. So of those people who are, for lack of a better term, the designated reporters in their building, we know that they're getting calls and being given information by teachers. So when teachers are in those Zoom classrooms, Google Hangout classrooms, whatever mechanism or platform that their district is using, teachers are giving some information to those reporters. They're getting some calls from community members or family members. And kind of a new thing that we started hearing about last week is that IT reports are now being shared. So many districts will have a filter system like GoGuardian or something similar that's on any of their devices. So anyone, teacher, student, anyone who's using their network devices, if you search for certain terms, you'll get a filter response that says this site is blocked. And you may have seen that on some of the networks you've been on it from time to time. Well, what happens in school districts is typically those filter systems will generate a report back to the technology department of which keywords were blocked, which search terms were people trying to access and were they blocked. So what we're starting to see in some districts, in some instances, now that all of these district-owned devices have gone out to students and they're not coming back in to be checked or anything like that, some of those designated reporters in schools, for instance, a school counselor is given access to those IT reports. So on Friday last week, I was working with a school counselor who had just been granted access to the Go Guardian reports for her school. And in that Go Guardian report, it had every student who had entered a search term that was blocked or had attempted to go to a site that was blocked. And when she was able to look at that report, she could see by student, for instance, one student, and she did do a DFCS referral on this one, had searched suicide 20 separate times. So she was able to contact a parent, do a referral, and to make some things happen because of that Go Guardian report. So I have a feeling we may start seeing more of that as we get deeper into the schooling from home or distance learning, however your district may be terming it. Next slide. So one thing to always keep in mind when we're talking about anything related to what schools or districts are doing is that Georgia is a local control state, meaning that we can issue guidelines from the state level, but all 181 school districts have the leeway to interpret things based on the needs of their local district. And within those 181 school districts, there are over 2,400 schools. So given all of those dynamics, distance learning and school at home are going to vary widely depending on where you are. So we know that different districts have different accesses to students. Some of them are using digital platforms with a vast majority of their students on those digital platforms. They're able to see students, they're able to interact with them pretty regularly. In some districts, it's mostly phones. So they're only able to get phone calls out, not a whole lot of digital access, not a whole lot of face-to-face happening. And in some districts, we know that there are restrictions that a counselor, a social worker cannot reach out to a student or to a family without having an administrator or another school employee on the line with them. In some places, when teachers have digital classes, there must be a school administrator or another district staff member in that online classroom with them. And in part, this is coming from some of the hacking that has happened in other instances, right? So if something like that were to happen, there is an administrator who is in that meeting. That is a protective measure for both the students and the teachers and everyone who's involved. And we know that some access is only happening when those meals are being delivered. There are some students that are only seen then. And we unfortunately know there are some students who nobody has seen since schools closed. Next slide. So, I'm sorry. Oh, I thought somebody said something. Okay, so how we can help. One thing that we have to remember, and it was a very good point, I saw someone put in chat, that in those online platforms and in those calls, there's no expectation of privacy. And I think that's one thing that we have to remember. It's something that we're hearing from educators in general. We're hearing it from teachers, counselors, nurses, administrators. We're hearing it from everyone. Even when there are students that they're concerned about and they're able to make contact, they don't have any way of knowing whether they're actually getting an honest conversation with that child, right? If it's on the phone, is that child in a room where they have enough privacy to be able to speak freely? If they're on a digital device, if they're in a Google Classroom, or if they're in a Zoom meeting, is there someone sitting nearby who's not on camera that prohibits them from saying or interacting in a way that they normally would? So I want to absolutely reiterate that what was said earlier, now that schools are closed, we have to depend on the new safety net. What can we do when schools can't get access to those students and we can't be sure that they're able to have really honest conversations or a good look at what's happening with students? So you can always call the district or call the school if you have a concern, but chances are you may not get anybody. So you can email the school, email the district, email the school counselor, whoever you need to, but ultimately it is all our responsibilities to make that report, right? So while it's certainly okay to contact the school, make those reports. And I did want to say that some of the ways that we know reports are happening, we do have districts where the school nurses are calling. We do have some districts where if a child has logged on to the platform, but no one's heard from them, they haven't logged on in 10 days, for instance, 5 days, whatever the cutoff may be, then someone is doing a referral or going out to check on them. So a lot of things are happening, but creating that new safety net. How do we figure out what to do when there's not that expectation any longer that school personnel are able to have those kinds of conversations with students? It's going to be really important that we start looking at school reentry. And this is something that is an overwhelming concern for everyone involved in education. There's a lot to going back to school. Right now, we're hoping and projecting that we'll be able to go back in July, August, like we would a regular school year. But there's, of course, no guarantee for that. And it's hard to know what happens next until we know what's going to happen next. So what's mandated reporting going to look like? Are there going to be exceptions for timelines, right? So when did this happen? Did it happen in March and we're not going back to school till August? What's the expectation around that? What's reportable given the kind of new normal that we're all going to be in? I know there's been a lot of conversation over the years around poverty, neglect, and how some of that kind of looks very similar, but is there going to be any kind of leeway around what's reportable or any kind of direction given around what is reportable and what's not? We're going to have kids who are going to new schools, and we're going to have kids who, whether by death, by choice, by removal, are going to have new guardians. So there's going to be a lot of things to consider as we're moving into school reentry that really can impact what mandated reporting is going to look like and what we all need to consider working together as we bring these children back online after this extended school closure.
Absolutely. Thank you so much, Cheryl, for those updates and just a response as far as what DOE is doing to address this. And I think you said it perfectly. We're all figuring out this new normal together. So oftentimes, and this is just for everyone on the line, these updates will sort of come and go and will be updated as you're updated in many instances. So we just ask that everyone just sort of express that grace for our leaders in certain systems and areas, because we're all sort of figuring it out day by day. So these are all great questions too to keep in mind as we move forward. So thank you so much for that. All right, so now that we've talked a little bit about how DFCS is responding and what their updates are, and we've also talked to the Georgia Department of Education about their updates and response, we just want to reiterate, again, as both of them stated, the importance of reporting. And that comes with just a reminder of how to make a report. So, of course, one way of reporting child maltreatment or child abuse is by calling the 1-855-GA-CHILD number. And both Cheryl and Jacqueline mentioned that during their presentations. So that number is listed here, 1-855-422-4453. Just some information that's helpful to know when you actually do make a report. Important information such as demographic information of the child, the name and the address, the child's parents or caregivers, who are those individuals if you have access to that information, the child's age, the nature and the extent of the child's injury, including any evidence of previous injuries, things such as that, any risk factors in the home or maybe outside of the home that you can share with the intake caseworker that you're speaking with, any prior concerns. So maybe this is something that you have suspected for some time now, and maybe you have a timeline of when you began suspecting the abuse or maltreatment, and you can provide that to the intake caseworker. And then include the child's current location and if there are any other children present in the home or present with the child. That's always great information to share. So these are just a few questions that Ms. Jacqueline Clyde shared with us regarding questions that a DFCS intake worker may ask you when you're making a report. So these questions are ranked in order to help DFCS determine child and family functioning. And DFCS is constantly and continually assessing these factors throughout the case process. So these may be asked several times in some instances. So what happened? Who's involved? That's one of the questions that they'll ask. The type of maltreatment, the injury sustained. Next, describe your observations. So a description should include details about the injury or the incident, the environment, the home conditions if possible. Third, when and where did the incident occur, and being as specific as possible with that information. Fourth, what was going on before, during, and after the specific incident, circumstance, or alleged maltreatment that you're concerned about. The fifth question, can you describe the caregiver's ability to protect or provide for the child and the child's ability to protect and provide for themselves? Is it an older child, a younger child? Does this caregiver or child have any developmental delays, special needs? Are they malnourished? These are all things to sort of figure out if you can. Of course, not doing any investigative work, but if this is information that you're already aware of, you're sharing that with the intake worker. And then lastly, if there are any family supports or additional comments or worker safety concerns. So for instance, in the midst of this pandemic, are you aware if this person has been sick in the last couple of weeks? Has the child been sick in the last couple of weeks? As Ms. Jacqueline Clyde indicated, that's now a question that's being asked. So we want to make sure that we're aware of that information as well, if possible. So there are also electronic ways to make a report. So the first option is to email a completed Georgia mandated reporter form to cpsintake@dhs.ga.gov, or you can also fax the form to the number listed here. We will be sharing these slides, and all of the information here is hyperlinked, so you'll just be able to click through it, okay? You'll also, with this form of sharing, you'll receive an auto reply confirmation and possibly a return phone call within 2 hours to acknowledge your report. So down here, we actually have an email address that you can email to request a PDF version of the form. We do understand that these forms get updated, so it's often best to request the most up-to-date version of the form. And we'll also try to make sure we have access to that form on our website as well at pcageorgia.org. The second electronic way to report is to complete a digital form on the cps.dhs.ga.gov website. And so what you have to do with this particular reporting method is you have to take an online mandated reporter training first to get a code. And so you'll receive a digital code after you complete the online mandated reporter training at prosolutionstraining.com. So once you go through that online training, they'll provide you with the code that is specific to your particular area of work or profession. And then you'll enter that code anytime you need to make a report using the electronic form. So in certain situations, it may be necessary to call law enforcement in addition to DFCS. So there could be a situation where a child is gravely ill in the home, or maybe a child was left unattended because someone else, the primary caregiver in the home or the only caregiver in the home, fell ill and had to be rushed to the hospital, or they just couldn't care for the child in that moment. So there may be times when you need to call 911. So typically what we say or refer to that as, DFCS refers to it as present danger. And it's basically an immediate, significant, and clearly observable family condition or child condition, individual behavior or action, or family circumstance, which is in the process of occurring. And it obviously endangers or threatens the health of the child or the overall safety of the child. So in some instances, calling 911 and DFCS may be necessary. 911 or law enforcement, they typically respond very quickly, whereas DFCS, it may be some time before they can process the report and get to the home. So sometimes with law enforcement involved, you may need to allow them to handle the situation, and then you go and make the report to DFCS yourself. So we just want you to keep that in mind. After a report is made to DFCS, there are a few things that we would like to point out. For our school personnel, for the most part, you'll receive confirmation of a report. Additionally, you'll also receive a case outcome within 5 days of completion of the investigation, and it will basically help you understand if the case is substantiated or not. It will not go into much more detail than that. Also, DFCS must send confirmation of report receipt to mandated reporters within 24 hours of the intake report when it's school personnel that are making the report. This looks a little different for those outside of the school setting. Additionally, some things to keep in mind: you may be called back to gather more information needed or to clarify. Of course, if you report it anonymously, that's a little bit harder. There's also a potential that you will need to appear in court, depending on the case or the report that was made. And then individuals with reports of child abuse that have been investigated and substantiated by DFCS will be placed on a state child abuse registry. We ask that you go through the online mandated reporter training, or when the world opens back up, the in-person mandated reporter training offered by Prevent Child Abuse Georgia, to understand a little bit more of this information. Really quickly, we're just going to share how DFCS responds to reports. So when a call or report is received by DFCS intake through the centralized intake system, it's typically reviewed at this point. It is reviewed, and then at some point, the call will be either screened in or screened out. And of course, they have strict criteria which they use to determine that. If the call is not screened out, it'll be assigned to a response time of either immediate 24 hours or 72 hours. And then the assignment of response time is based on the danger assessment that they conduct by the intake person or the intake worker. After the report is assigned, a response time is sent to the county DFCS office and assigned to a caseworker who must go and meet with the victim child and assess the family situation. So, and they of course do so within a predetermined response time. After the caseworker has conducted the interview and assessment, they'll meet with their supervisor and determine the track assignment. So if the case will be assigned to investigations or family services or what have you. And we understand that this is unique to each and every report. Things can look differently depending on the case. So we just want to help you have a general understanding of the process. So before I move on to the next section, I want to ask Ms. Jacqueline Clyde or Ms. Melanie Carrillo if you all have anything to add to that, especially because you're our DFCS experts. And of course, if you do, I can unmute you. Ms. Clyde, did you have anything to add to that?
Yes, some of those investigations, or see even before the investigation gets underway, some of those cases the child can be taken into foster care before an investigation is complete. Mm-hmm. So just be aware that if the child is, like, for instance, you said that the child, the parent is incapacitated and there's no other caregiver, it may be necessary to bring that child into care involuntarily into care without going to court or anything like that. Just make sure the child has a safe place to stay until an investigation can be completed.
Absolutely. Thank you for that. All right, so now we're going to pass it along to Ms. Tiffany Sawyer with the Georgia Center for Child Advocacy to talk about some prevention resources. So what does information retention and sort of general awareness look like before we get to mandated reporting or having to report? And then what are some resources that we can use to support our professionals and our youth? So I'll give me 1 second to add her to the call. Tiffany, can you hear me?
I can. Can you hear me?
Yes, ma'am, I can. Thank you.
All right, wonderful. Well, good afternoon, everyone, and thank you so much for Prevent Child Abuse Georgia for putting on this webinar. Incredibly important all times, and especially during this time as well. So I'm the Director of Prevention with the Georgia Center for Child Advocacy, and we're a child advocacy center serving youth who've been abused and neglected, and my role in prevention is to provide education and awareness both to adults as well as to youth across the state of Georgia, specifically around sexual abuse prevention, really all types of abuse, but sexual abuse prevention is what we do most, and sex trafficking. And so I wanted to share some resources with you all during these times as they become more and more critical. So one thing that I wanted to share is just, I know there's a lot of fear and anxiety that comes with our kids being, left within situations that in some cases are problematic for them and dangerous. So I just want to reiterate that the connections that we have with children, especially those connections that children have with adults outside of their parents, are incredibly important, not just to ensure their safety, but also for their mental health and emotional well-being. So I want you to think creatively about how we can have interactions with youth, whether those are teachers or other school professionals. It could be nutrition staff or bus drivers that are delivering food to families in need. Think about who is having interaction with children during these times. That could be face-to-face with neighbors. It could be virtually through some of the online learning that we're doing. It's really important to provide encouragement and to continue to build a rapport with children and engaging them in ways that allows us to let us know a little bit more about what's going on in their day-to-day life, but also so that we can let them know that they're loved and that people are thinking about them during this time and that we want to hear from them. So always ask open-ended questions when we're engaging children. So thinking about, how they're feeling today, if they had, one word to describe how they're feeling about learning or just this time during social distancing. How is that going? Tell me a little bit more about that. Even engaging children in little activities or singing a song and then letting them know how that makes them feel does a great job in allowing us to engage with children a little bit more. I think it's also important that we're continuing to educate ourselves, just like this webinar, but thinking about others who might be interacting with kids. If we're able to go out into the world before school starts again in July or August, whenever that might be, think about who might be the first people that will interact with children during those times over the summer, if we are able to go out. So that might be camp counselors, it might be a child care center, it might be faith leaders, it might be some kind of, Boy Scouts or youth serving organization. And so this would be a really great time for all of those professionals and individuals to get some training on mandated reporting and prevention education so that they're prepared when kids come back into their world. There may be an influx of reports during that time, and those folks are also mandated reporters. So I want to just make sure that we're not forgetting those individuals. So some prevention trainings that are available right now online. I wanted to share a lot of different free resources. For those of you that are familiar with the work that we do across the state with the Georgia Center for Child Advocacy, we provide Darkness to Light Stewards of Children training, which is focused on child sexual abuse prevention. Their training is available online through the Flip the Switch campaign. And all of these resources will be provided to all of you in a document after the training. Am I right, Naisha?
Mm-hmm. Yes.
Okay, great. So don't feel like you have to write it all down. It'll be sent to you all afterwards. In addition to the Stewards of Children training, Darkness to Light has created a specific training of protecting children during a crisis. It is focused mostly for parents, and it talks about some of the added difficulties that parents might be facing during this time. So it helps them identify ways that they were protecting their children prior to COVID-19 crisis, and then thinking through how that has to shift during this time. So things like talking to other caregivers, making sure that we're creating some boundaries, some physical boundaries, no closed doors within the house, things like that. So that's a great resource. It's available online for free. It takes about 30 minutes to complete, and there's a certificate of completion afterwards. I think the other thing that I would say for professionals is to think through the children that they're concerned about. So whether those kids that you're working with on a regular basis This may be children who have had previous reports of abuse or children who have expressed issues in the past. These could be kids that are experiencing any kind of physical or mental disabilities or delays that may need extra support during this time. I think it's really important that we are checking in on those children. And this is both for professionals as well as personal relationships that we have. So any way that we can check in with kids, video chat with them, or just have a phone call. And I would say if you are used to seeing kids on a regular basis, let's say you're a teacher, think about a check-in with each of the children that you serve at least once a week. So is there a way that you can track, you know, have I heard from this child? Has this child turned in homework? You know, have I had any kind of interaction with this child this week? And if not, maybe pay extra special attention to that child and try to keep a reminder for yourself to do that. Some online resources for teachers. Darkness to Lights has put together a safe online learning for teachers. So things like setting clear expectations, just like they would in a classroom. What are the rules and responsibilities that are really important when you're doing virtual learning? And making sure that those are followed during that time. Maybe it is getting parents involved, and how do they need to be involved during the time that we're doing virtual learning. Things like creating a digital learning plan and minimizing the opportunity for inappropriate things to be shared over the internet through that kind of classroom. So those are some really good resources that would be available for teachers and others that interact with youth on a regular basis. So now I want to switch to thinking about prevention resources for parents. So in addition to some of the ones that we mentioned on the previous slide, some resources specifically for parents are some prevention trainings online. There's one called Talking to Children About Safety from Sexual Abuse. So this is a great opportunity while where we have time around the dinner table or extra time that we're spending with children to have conversations with children about their bodies, about consent, about personal boundaries, safe touch. And the Talking to Children About Safety from Sexual Abuse is a great short training. It takes about 30 to 45 minutes. It has a lot of good resources about how to start that conversation and how to continue that conversation as children get older and go through different ages and stages. Really talks about healthy sexual development. So what are some things to look for, some signs that you might want to look for that a child might be going down a difficult path. The other thing to think about, and this is something that we don't always like to talk about, is inappropriate behavior between siblings, perhaps, or between peers of around the same age. This is another good time to have those conversations with all of the children and talk about consent. You know, she doesn't like that tickling game, let's stop that. Or we're not going to have that kind of interaction. You know, it's not a great topic that everybody wants to talk about, but it's a really important one because we know very often that youth are exploring and boundaries can be crossed in that way if we're not addressing those up front. So this is a really good time to have those conversations. Some other things that I wanted to share, some resources from other organizations, is creating a family safety plan. So Stop It Now is an excellent national organization around abuse prevention, and they have a sample family safety plan that you can use. So things like setting family rules together and talking openly about how we protect each other within our family, making sure that everybody's educated. setting those clear boundaries, identifying other safe adults outside of the home. So can we call and talk to the neighbor? Can we call and talk to grandparents or aunts and uncles? You know, who are some other individuals, some family friends that we can talk to when we're just not feeling safe or we need somebody else to talk to? So that would be a great resource to use for setting family safety plans. Also, for those of you familiar with Committee for Children, the Hot Chocolate Talk, they have regular Hot Chocolate Talks, which are videos that come out every so often, and they address different difficult conversations that we might have with children. They have a great resource specifically around what to say at different ages and stages, and so it divides it up based on the age of the child, and so that would be a really great resource for you all to use. Speaking of Committee for Children, and one thing I didn't add to this slide that I would love to just bring up is many of you might be familiar with SB 401, which is the mandate to provide prevention education for youth, grades K through 9. And now that kids are not being seen in schools, a lot of that education is going missed. However, Committee for Children, which has the Second Step program, so any of you familiar with Second Step and their Child Protection Unit, as well as the Monique Burr Foundation, which has Child Safety Matters and Teen Safety Matters, they're both providing some lessons for educators to provide those trainings online for students. So how can they virtually provide those trainings? That would be a great way to get information out to children that we're worried about. It could just be something that's done for all youth, and then that way it's another touch point that we're having with children to let them know that if something's happening at home, that's not okay, and here are some numbers to call. So that would be a good resource that I think would be really great, and I am happy to add that to our resource list because I neglected to do that before. Sorry about that, Naisha. The last resource that I want to share is around online safety. We know kids have extra access to online platforms now, and the National Center for Missing and Exploited Children, through their NetSmarts Kids program, they have great resources for parents around protecting kids while they're online. And they also have a good course for kids with multiple lessons around online safety through NetSmarts Kids. That's called Into the Cloud. They also have resources for a parent tip sheet and how to contact the cyber tip line if you see anything that's inappropriate for kids. So that would be a great resource as well. And I believe that is all I have to share. Thanks so much for having me, Naisha.
Thank you so much, Tiffany. All of that information was so helpful. And I did end up taking the Protecting Children During a Crisis training that you mentioned on the Darkness to Light website, and it was very helpful. I'm not a parent yet, but it was helpful to just think about things proactively instead of reactively. So thank you for sharing that resource and all the other great ones that you shared. Again, we just want to reiterate that all of this information will be available to you all in a document, so you will not have to write down or try to keep track of the links. That is why we linked everything in the presentation. So another great resource that we would like to share with you is the 1-800-CHILDREN helpline. And this helpline is a great option when there is concern for abuse and neglect, or there's simply a need for resource linkages. So the 1-800-CHILDREN helpline is a free statewide resource and referral helpline for parents, caregivers, professionals, anyone who has any type of interactions with youth and their families, or simply have a concern about a child and just would like some questions answered. So the great thing about the helpline is that you speak with a trained information and referral specialist who is trained in child development. They understand mandated reporting. They understand child sexual abuse, so they can answer questions around that. Also, they can help refer a family to resources in their area. Another great feature with the helpline is the added 1-800-CHILDREN resource map. And basically what we did was take all 3,000 plus of the resources we have in the state of Georgia and geocoded them on an interactive map, which is free and accessible on our website at PCA Georgia helpline.org. So we understand that sometimes a report needs to be made, but sometimes a family needs to be linked to some great resources. So we encourage families, especially during this time, to call professionals. Please, we have resources that we can hand out to you on our website that you can share with families as well. And people call for a variety of reasons, whether it's caregiver support or counseling. Maybe they have some domestic violence concerns. The helpline serves professionals that work with families, faith communities, and crime victims or survivors of abuse as well. Another great resource that we wanted to share, and thank you so much, Angie Boyd with Children's Healthcare of Atlanta, is the Child Help resource. And basically, Child Help, they're a great organization that provides a lot of youth-focused and child-focused resources. They have a great feature that would be helpful, especially for reporting or concerns when it comes to youth who may not be able to call the 1-855-GA child number. So on their website, childhelp.org, a child or a youth can text or call their hotline or helpline number to get assistance. And the Child Help information and referral specialist or the hotline specialist will actually help facilitate a report to wherever they need to report, whatever their state is. So if they're texting or calling from Georgia, they'll help facilitate a report in Georgia. Additionally, there's a chat line on the website as well. So this may be a great option if they do not have access to a phone, but they are using their computer, and maybe there's a moment for them to chat privately with someone without someone looking over their shoulder, of course. This is one example of the flyer that they use to advertise their text, call, and chat line. And they have a lot of great resources encouraging you to speak up if they feel that their safety is being threatened or they don't feel safe in whatever current situation that they're in. Some other great resources that we wanted to provide were related to basically mandated reporters and how they should basically facilitate a report to DFCS. So this purple fact sheet that you see here on the left is a great resource encouraging all adults to become mandated reporters, essentially, because now the responsibility falls on all adults, whether they are directly interacting with our children in a school capacity or if they are volunteering for a food drop-off service or they're a clerk at a grocery store. So we want all mandated reporters to feel comfortable when it comes to reporting. So this fact sheet just lists some of the signs that a child is not safe, and we want to thank our friends at PCA Missouri for creating this great resource. Additionally, it's been updated, of course, with all of our information. It's encouraging adults to trust their gut and to go ahead and make that report if there are any concerns. So we encourage you, if possible, to share this resource. It is on our website down here. It's linked and it is printable. You can download it and share it out as you please. This is a free resource. Additionally, on the right-hand side, we have this green fact sheet here, a tip sheet, which is specifically for our school personnel and our educators. And it has some helpful tips on protecting children, even when you're only interacting with them virtually. So Tiffany mentioned this earlier, and of course, Cheryl mentioned this earlier as well, maybe reaching out to those students or those youth that you have some extra concerns over when it comes to them being at home, or maybe they haven't been responding to the question prompts in the virtual classroom, or they haven't been submitting assignments, really reaching out to make sure that they're okay. Continuing to let students know that you're supportive of them. And then, of course, all of the information necessary to make a report to 1-855-GA child. These are two great resources that were developed to advertise mandated reporting, or to advertise sharing or telling an adult, a trusted adult, that a child does not feel safe. So these two posters were developed for children and youth in elementary schools and in middle and high schools. So these posters are available on our website and completely free to download and to use throughout, whether you use them virtually and electronically or physically. So the first one is for our elementary school students. It has information on how to report, so by calling the 1-855-GA child number, and it has some more information about domestic sex trafficking as well. On the right here, you see a poster specifically for middle and high school students. And so it just gives information on how to make a report who to call, and just helping them understand that you're not alone in this. So again, all of these resources are free and linked on our website, so you do have access to them. And we just want to briefly mention that there is free online mandated reporter training available to you through Pro Solutions. And Pro Solutions is one of our awesome partners. They do training across the state of Georgia, and they're not only restricted to mandated reporter training, they have so many different offerings on their website. But just to note, there are 3 different types of mandated reporter training that they offer. They offer a general mandated reporter training, which basically helps individuals understand their legal obligation related to reporting suspected abuse and neglect and how to make a report. They also have a training on mandated reporting requirements for employees, volunteers, and contractors of Georgia Public Schools. So this is a great resource for our educators and those that are a part of the public school systems that are looking for that information specific to their roles. And then additionally, they have mandated reporting requirements for Georgia medical professionals. So helping them understand their legal obligation and some of the nuances that come with being a medical professional and having to report. So a great resource. We encourage you, if you have not taken the training, please do so. Even though we're in the midst of COVID-19, we do want to mention that PCA Georgia offers a free in-person mandated reporter training. So when the world opens back up again, we will begin accepting requests for this training. So we just wanted to mention that. But if you are interested in becoming a statewide trainer for our in-person mandated reporter training, we have a TOT coming up in June, a training of the trainer. So please visit our website at pcageorgia.org so that you can submit an application, and hopefully you can become one of the 50+ trainers that we have throughout the state. So we went through all of that information so quickly. I know some of your brains may be hurting right now, but we want to jump to some Q&A just to help you all understand or get through some of those nuanced questions that you had. We had a few people suggest or submit some questions to us in advance. So what I'm going to do is try to unmute our presenters for today so that they can talk with us and answer some of these questions. So I'll just go through them quickly. And I know that some of these are related to the questions you all have been putting in the chat. So the first question that we received was, are there resources and conversation templates for school nurses and school counselors to use when they call to check on students? And Tiffany, I'm going to direct this question your way if you could answer this for us.
Sure. So I had covered some of it during the first part of what I shared, but I think, again, just reiterating open-ended questions, not leading. School professionals are not investigators, so it's important to just have open-ended conversations with kids. Any way that we can keep kids engaged, listen calmly and openly for them to just talk about how things are going during this time is really, really important. So, asking feeling questions, what does it look like at home? Who's with you at home? That might be a good question. Who are you hanging out with at home? And you make sure not to ask those questions in a judgment, with any judgment. But just asking those open-ended questions to get a sense of how kids are doing. And like Cheryl mentioned earlier, we don't know anything about who's listening to this conversation. So the more we can keep it out in the open of, hey, how are things going? That kind of thing, and not showing our concern right away, but noting it maybe privately to ourselves would probably be best.
Awesome. Thank you for that. We had another great question from someone that says, how can you differentiate between child abuse and brittle bone syndrome? So I'm going to let Angie Boyd, Dr. Angie Boyd with the Stephanie V. Blank Center for Safe and Healthy Children tackle this one. I just unmuted you, Angie.
Okay, great. This is one where you really are going to want to make sure that you have connected with either a child abuse pediatrician. There are 3 of them in Atlanta, 1 in Macon, and there is a child abuse trained pediatrician in Savannah, and get their expert opinion and advice. There are specific blood tests and other imaging studies that would need to be done. You're going to need to have a very detailed history from the caretakers regarding fracture history. It is very rare to have a child with true osteogenesis imperfecta, which is the medical name for brittle bone disease, that has no fractures up until they turn 4. And now all of a sudden they fell and broke their arm, and the caretaker insists it is OI. That's not likely. So you really want to make sure you get somebody involved who has experience in dealing with these cases, knows what to look for, knows what other things may need to be ruled out. There may be a true vitamin deficiency that has led to an increased risk for fractures. It might not be OI, but it may be something else organic that needs to be addressed. But you definitely want to reach out to a pediatrician who has training and can recognize what's going on.
Thank you for that. Awesome. And we have one question. Someone wanted to know, is there a specific protocol for caseworkers when making face-to-face visits, such as placing children in foster homes? And Ms. Jacqueline Clyde sort of alluded to it earlier, but I'm going to let her just reiterate what she stated a little bit earlier. So I just unmuted you, Jacqueline. Let's make sure it's actually going to let me do it. Okay. Can you hear me now?
Yes.
Sorry, it took a moment.
Yes, on that that email that was sent out on to all DFCS staff on the 16th of March, in the SOP itself is specific, has specific steps that a person would take if they have an initial contact with the family, what steps they need to take, precautions, and how would they interact with the family. It also breaks it down as to if the child was if they had a preservation case, a family preservation case, what those specific steps look like, and the foster care section on that email. So everyone in DFCS child welfare should have received that email. If not, I can forward that email to anyone specific that needs it.
Awesome.
But it came from the Office of Communications.
Awesome. Thank you so much. Thank you so much. So I just want to take the time to thank our presenters today. Thank you so much to Ms. Jacqueline Clyde with DFCS, with the CPS intake. Thank you so much to Cheryl Benefield with the Georgia Department of Education. Thank you so much to Tiffany Sawyer with the Georgia Center for Child Advocacy. We really appreciate the time that you all put into this. We had to kind of do this quickly to get it out to you. I will reiterate that we will be sending this information out, so it will come in the form of an email. The email will be sent out to the email address you use to register. So if you don't see it in your main email address, please just check the one that you use to register. We will send this information out. Also, we have an evaluation that's coming out, so please fill out the evaluation. And we're working on developing a Q&A sheet from the questions that we collected from you all today, so that we'll put that out on our website as well. So all of this information will also be available on pcageorgia.org. And this webinar is being recorded, so you will have access to it. I do apologize that we're a few minutes over our schedule, but thank you all so much again. We had at 1,000 people on this webinar, so there was a clear need for this topic. So we do appreciate you. And if you have additional questions, feel free to email us at preventchildabusega@gsu.edu. All right, and that is the end of our webinar. So I will stay on for a few more minutes, but we thank you all for coming and attending.
Thanks, Naisha.
Thank you.